This week on ICN, the stories you should have heard, but didn't. Congress takes money from the military to buy private jets for their own travel. Swine flu vaccine manufacturers get immunity from future lawsuits. New York State Nurses Association comes out against mandatory health worker vaccinations. Those stories and more next on Informed Citizen News. Hello and welcome to ICN, Informed Citizen News, August 9th, 2009. Based on comments from viewers and our own observations, the YouTube view counter doesn't appear to be working all that well. So we're asking all viewers watching this broadcast to participate in our own informal audit. So for this show only, we request everyone who watches to rate this video. For those who don't have a YouTube user ID, you can send an email to feedback@informedcitizennews.com. You don't have to write anything in, just send an email and that will count. We have provided an easy link to our email address in the video description section to your right under More Info. It won't be exact, but this audit will show the relative accuracy of YouTube's view counter. Thank you for your help. This week, the government reported a slight improvement to unemployment. July unemployment fell to 9.4% from 9.5% in June. The White House did say that it expects unemployment to reach 10% this year. But here is what the national media fails to report. The regular unemployment number only includes those who are not working and have actively looked for a job in the previous month. Real unemployment, otherwise known as U6, is at 16.3%. In addition to what's in the regular unemployment number, the U6 includes those who have not sought employment in the previous 4 weeks and those who are underemployed. Underemployed workers have settled for part-time jobs but still wish to work full-time. Although there was also a slight improvement of 0.1% in the U6 this month, the fundamental structure of unemployment worsened. The number of people who've been out of work longer than 6 months soared by a record 584,000 to a count of 5 million. Those people who are considered long-term jobless account for more than 1/3 of all unemployed, the highest percentage on record. We have to make a slight correction to a report we gave on July 12th regarding the number of men, women, and children in the United States on food stamps. ICN reported that there were 32 million Americans currently receiving food stamps. That statistic was from February of 2009. The latest report, as of May 2009, indicates that there are 34 million using food stamps. That's an astounding 11% of the population. In a do as I say, not as I do moment, Congress plans to spend $550 million to buy 8 jets to help accommodate growing travel demands for congressional officials. In order to purchase the private jets, Congress has to redirect money already committed to other important items in the defense budget. Jeff Morrill, a Pentagon spokesman, said, "It forces us to take money from things we do need to fund and redirect it for things we don't. And in a time of war, we just can't afford that." The list of jets to be purchased for congressional use include 3 Gulfstream 5s, the type owned by major celebrities and CEOs, and 5 Boeing 737s. A few months back, Congress feigned anger when executives from companies receiving bailouts used their private jets to fly to congressional hearings in Washington. Let's see, 3 Gulfstream private jets, $198 million, 5 737 private jets, $350 million. Congressional hypocrisy, priceless. The World Health Organization said that 30%, or 2 billion, of the global population will likely contract the swine flu by the time the pandemic runs its course. The last total of diagnosed cases was 134,503. Of those, 816 people died. This is a 0.6% fatality rate of diagnosed cases. But scientists have said that many cases, maybe in the millions, have gone undiagnosed due to the cases being mild in nature and did not warrant a doctor's visit. That would put the real fatality rate of the swine flu in line with the annual seasonal flu. This week, Novartis began human trials for their swine flu vaccine. The year-long trial will include 6,000 people and will likely involve a two-shot protocol with immune-boosting adjuvants. Novartis plans to have their vaccine on the market prior to completing the testing by utilizing a fast-track approval process. Under the provisions of a 2006 law for public health emergencies, vaccine makers and federal officials will be immune from lawsuits that result from any new swine flu vaccine. The extension of legal immunity for the swine flu was signed by Secretary of Health and Human Services Kathleen Sebelius last month. Another example of government giving all the rewards to big business while shifting the risk to the American people. Baxter International, one of the prime manufacturers for flu vaccine, filed a patent in August of 2008 that laid claim to vaccine production methods and specifically listed the H1N1 swine flu virus as one of the potential vaccines to be developed. The H1N1 virus has been around for years, but Baxter was most prescient with their patent filing in 2008. More than half of children taking the swine flu drug Tamiflu experience side effects such as nausea and nightmares. Studies of children attending 3 schools in London and 1 in southwest England showed that 51 to 53% had 1 or more side effects from the medication, which is offered to everyone in England with the swine flu symptoms. So in 99.99% of the cases, the treatment is worse than the disease. The New York State Nurses Association has come out against a state regulation that requires every healthcare worker to be immunized against influenza. The regulation has been adopted by the New York State Hospital Planning and Review Council. It's intended as a defense against a possible fall outbreak of swine flu. Eileen Avery, Associate Director of the Association's Education, Practice, and Research Program, said that the flu vaccine is not 100% effective. There is no guarantee that in any given year the public will benefit from mandatory immunization of healthcare providers. Nurses weighing in against mandatory vaccinations. There are unconfirmed reports that American embassies have been instructed to convert 1 year's worth of US dollars into local currency. These reports come from usually reliable sources, but ICN could not independently verify. If true, then it shows concern for the value of the US dollar over the next year. This report comes at the same time the dollar has dropped in value by 10% over the last 4 months. We do have to treat this as an unsubstantiated rumor until solid evidence presents itself. Thank you for joining ICN this week. We'll let you know the results of the YouTube audit next week. Americans need to be informed, so please send our link to your friends and family. From all of us at Informed Citizen News, see you next time.